Hi, I'm Brad Leinberger, President of Seaside Wealth Management, here to empower women around their wealth. Our mission is to help you create peace around the issue of money. This week's topic for what every woman should know about her finances is all things Medicare. So how does Medicare work? First of all, what is it? How does it work? So Medicare starts at age 65, and this is the health insurance plan that you'll go on when you're age 65. Now, do you have to sign up for it? Are you forced to? You're not forced to. If you continue to work past the age of 65 and you're covered by a group plan at work, that's one of the situations where you don't necessarily need to sign up at age 65. But as soon as you leave that group plan, if you're over the age of 65, you have 7 months to make sure that you get signed up. Now, how does Medicare work? And it's almost the alphabet soup where there's Medicare Part A, Part B, Part C, Part D, all the way through Part G. There's so many moving parts. We want to try to simplify it and break it down for you so you feel empowered around Medicare and making good decisions. So Part A is going to cover your hospital stays and your hospital visits. It's not really going to cover long-term care. That's where having long-term care insurance, or at least a plan around how to pay for long-term care, comes in. Medicare Part A doesn't really cover it. Medicare Part B covers your doctor visits, the inpatient things, seeing your physician, that sort of thing. Medicare Part C is the supplemental Medicare insurance, or the Medigap insurance, that's going to cover the things that regular Part A and Part B don't cover, to limit how much you need to come out of pocket with. There is a cost to purchasing a Medicare Part C policy. If you need an introduction to a specialist who is really well-schooled, well-versed in all things Medicare, we can make that introduction so you can get educated around choosing the right Medigap or supplemental policy for you. And then, of course, Medicare Part D, that covers the prescription drugs. There's also a cost for that. And I'd be remiss if I didn't mention that there is also a cost for that Medicare Part B, and that's the doctor visits. So that part, if you're on Social Security, Medicare Part B is withheld from your Social Security check. If you're not on Social Security yet, you'll just make the payment and you'll pay the bill every month. So do be aware that there is some cost associated with Medicare, but when you compare that to purchasing a policy, a private policy in the open market, it is far less expensive to go on Medicare, and the quality of coverage typically is much better than you're going to get for less money. So when choosing the right supplemental or Medigap policy for you, what are the things you should consider? You should think, are you an HMO kind of person or a PPO kind of person? That's the first decision point. Do you want to go, are there specific physicians that you want to go see, certain doctors that you have a history of working with, that you want to work with? And so these are the decisions that when you work with a Medicare expert, they'll help you think through and then guide you towards purchasing the right Medigap or supplemental policy. So I know that Medicare can be very confusing. The big takeaways: it starts at age 65. It is quality coverage, and it's a lot less expensive than purchasing on the open market. There is a cost to it, and you can plan on that cost being anywhere from $360 to $500 a month per person. But again, it's less expensive than buying this thing on the open market. So I know it can be confusing. If you have questions or want to discuss it further, please feel free to give our office a call, send us an email, and let us know, and we're happy to help. I hope you've enjoyed this week's edition of What Every Woman Should Know About Her Finances.